Good afternoon, ladies and gentlemen. I'm Yasmin Akhtar, representing Zindagi. So today we are going to discuss the topic treating hepatitis C as co-infection in Pakistan and challenges and solution with reference to the PWID perspective. So to start with, may I have next slide, please? Okay, to start with, I would like to reflect a little bit on the significance of hepatitis C management as a co-infection with reference to the published evidence, and you can see the references at base of the slide. Co-infection with hepatitis HIV accelerates the progression of hepatic fibrosis and results in a more aggressive course of liver disease. Cirrhosis has been observed to occur 12 to 16 years earlier in persons co-infected with hepatitis C and HIV compared with those who have had HCV monoinfection. And for persons living with HIV who have hepatitis C co-infection, liver-related morbidity and mortality is a prominent non-AIDS related complication. Up to 80 to 90% of the liver-related deaths in persons living with HIV are attributable to hepatitis C infection. And then HIV can accelerate hepatitis C disease course, leading to a more rapid progression to cirrhosis, liver failure, hepatocellular carcinoma, and increased hepatitis C virus-related mortality. Now, representing the perspective of PWID program, it's important to review some figures to understand the high level of disease burden within this key population. A systematic review and meta-analysis study of 408 selected articles from 2008 to 2018 show that the global prevalence of HIV and hepatitis C is in PWIDs is particularly 13%. Co-infection of HIV and hepatitis B virus is 2%, and hepatitis C and B co-prevalence is 3%, and having all the three co-infections together, it's 2% respectively. Studies with different methodologies in various regions establish the range of 58 to 92% of hepatitis C infection among PIVID. And now I would like to reflect the data, the program data. So Zindagi has recently started the routine screening of hepatitis C into its harm reduction program, and routine screening data for 45 districts, and the number of tests is 4401. We have seen 68% of the tested PIVID were hepatitis C positive. So I am only mentioning the prevalence of hepatitis C among PIVID regardless of their HIV status. And for co-infection of hepatitis C and hepatitis B in HIV positive PIVID, Zindagi has result records of almost 10,000 PIVID who have attended our residential 3 to 6 weeks of residential care program ART adherence units. And the results turn out to be 93% of co-infection of hepatitis C virus and 4% of co-prevalence of hepatitis B virus. Okay, we had few challenges to integrate the hepatitis C treatment linkages into our routine harm reduction programs, such as routine screening among PIVID was not available before 2024 in Pakistan, as only HIV positive PIVID were tested by ART clinics. Now the screening has been integrated into routine HIV prevention and harm reduction program by Zindagi from February 2024. So there was an urgent need to respond to the treatment linkages of HIV and hepatitis C co-infection for PIVID, and an attempt was made to integrate this treatment through the Global Fund supported intervention, but unfortunately it was not previously agreed by the stakeholder, and we were suggested to have this intervention by establishing the linkages with the vertical care programs at the provincial level. But when we started this journey with the provincial level health facilities, we had certain challenges which I have listed down here. So the foremost, the main obstacle was the requirement of CNIC for treatment enrollment, followed by unavailability of diagnostic PCR tests, thereby causing inability to determine eligibility, shortage of medicine supplies periodically, and then transportation issues, lack of one window operation and one-stop model approach. Thank you. In order to address the barrier and challenges, Nayi Zindagi executed few steps which I am going to mention here, and these steps reflect different milestones we achieved mainly in last 2 to 3 years, except for point number 1, as primary prevention of blood-borne infection was always an integral part of our harm reduction services since the start of the program. Nayi Zindagi established hepatitis C screening services into routine testing program with pivot from February to enable early identification and management of hepatitis C infection. Nayi Zindagi closely worked with Aga Khan, and we are really thankful to Dr. Saeed in managing all this and helping us to devise our program for specific for and to cater the needs of the people who inject drugs. So Nayi Zindagi with Aga Khan in 2022, we referred 78 eligible pivot co-infected with HIV and hepatitis C who were adherent on ART primarily. And Aga Khan has kindly facilitated through their Zakat program for their treatment linkages, and this intervention, this pilot actually helped both of us, Aga Khan and Nayi Zindagi, to understand it in more depth and design with a reasonable program to move forward. So considering the success of the pilot project, Nayi Zindagi proposed hepatitis C treatment for Pivot partners, Pivot and their partners to Global Fund, and secured resources for 609 individuals in 2023. And then Nayi Zindagi has proposed a treatment course of 12 weeks of SoftWell in consultation with Aga Khan, especially Dr. Saeed. A series of consultations were held with Aga Khan and SoftWell. I would like to mention, although Dr. Saeed has already reflected quite important things on the treatment regime. So why SoftWell was selected for Pivot? The reason was that it was a single pill combination and likely ensures compliance compared to two separate pill combination of SoftDec. SoftWell can be used for 12 weeks in non-cirrhotic as well as compensated cirrhotic patient, thus making treatment decisions easier and the length of time shorter, whereas SoftDec has to be taken up to 24 weeks for compensated cirrhotic. So this is another thing that because cirrhosis is quite prevalent in Pivot, so which may be a reason that SoftWell is a strong case to be used for Pivot. And again, SoftWell is also approved as a pan-genotype treatment combination. Nayi Zindagi contracted hepatitis C treatment services in 11 districts from July 2023, and so far 784 Pivot have been referred for hepatitis C treatment, comprising 753 male Pivot and 31 female spouses. Almost 70% of the beneficiaries are between the age of 20 to 39 years old. 592, which constitutes 75% of the total eligible for treatment. They were referred for the treatment, and among those who initiated treatment, referred, 96% were put on the treatment, 573 people on treatment. Out of these put on treatment, so far 81 clients were eligible for post-treatment PCR, and we had post-treatment PCRs for 70 clients, 88%. And it has been observed that 70 people have been found hepatitis C negative so far, suggesting success of the program and a strong case for scalability and replicability in terms of fostering collaboration. For 2024, treatment resources were further secured for 1,200 clients with the help of Global Fund. We hope that this will lead to the process of packaging hepatitis C treatment for Pivot at a large scale in the next Global Fund grant cycle 2024 to 2026. At the end, there are few recommendations to enable our desired response to manage hepatitis C virus as a co-infection, which include screening of hepatitis C virus at primary care level, simplification of policies and procedures to the optimal level in order to increase access to treatment and desired retention, adoption of mobile rollout strategies to determine PCR diagnostics for treatment eligibility, and proper monitoring and record keeping systems to track the progress of outcomes. Thank you so much, and for any question and answers, I am available here. Thank you.